I was first drawn in towards neurology probably more or less as soon as I started medical school. My grandfather sadly was diagnosed with Parkinson's disease within 6 months of me starting at medical school, so I naturally took an interest in that illness. I may be a bit biased, but I think the nervous system, the brain and the nerves are the most interesting part of the body. We know so little about the brain, I think, compared to other organ systems. And there's so much scope for development of treatments, and even the most well-known neurodegenerative diseases, Alzheimer's disease, Parkinson's, whilst we know some of the mechanisms involved in how these illnesses progress and what the pathology is within the brain, we still have very little idea about what triggers them. But I think that just because you can't cure an illness doesn't mean to say that you can't have an enormous impact and help these people by delivering good care and looking after them well. There was a patient who came in, a relatively young patient who was an ambulance driver, and he was severely ill with paralysis of all his muscles, and he deteriorated quite quickly and ended up in intensive care. And it was thought that he might have a Guillain-Barré syndrome, but there were unusual features of central nervous system involvement. So Guillain-Barré usually just affects the peripheral nerves outside of the spine and brain. We investigated him, and we believed that it could be due to COVID-19 infection. And instead of, as well as giving the standard treatments for Guillain-Barré syndrome, we gave him high-dose steroid. And his wife was called in to maybe say goodbye to him because we thought he might not make it. And when we walked onto the intensive care unit in our full PPE gowns and everything, he was sitting in a chair. After having the steroid medication, he'd made a miraculous recovery. So it was a brilliant moment when his wife thought she was visiting him to say goodbye, and then when we turned up, he was sitting out in a chair wide awake.